Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Doctor, we are in a time when we are living with COVID-19. This does not stop mothers from giving birth or even breastfeeding. But how do we deal with a situation where either the mother or the baby or both are infected with COVID-19?
In case the mother is COVID positive and the baby is maybe COVID negative, it is better that they still room in with the mother wearing a face mask and a shield if possible most of the time as she continues to, because accessibility enhances breastfeeding. If the mother is in the same room with her baby, it is easier for her to continue breastfeeding. But in case the mother is a bit uncomfortable, the baby can be isolated away from her and brought in at the time of feeding. Sometimes both mother and baby are sick. Yes, we still recommend that they continue breastfeeding the baby, because breastfeeding is going to give nutrients to the baby, antibodies, and this is actually going to help the baby fight the infection. In the event that the mother passes on, because we've seen it happen, most especially when the previous wave, the second wave, depends on the size of the baby, okay? When the baby is preterm, is born premature, we still prefer that the family tries as much as possible to get a breast milk donor so that we still breast milk feed this baby. It is safe to feed the baby with breast milk of another mother as long as the mother has been screened for infections like syphilis, hepatitis B and HIV, and the hygiene is good. We can still get donated breast milk for that baby. If the baby is term and the family can still get a safe milk donor for the baby, we still would prefer to breast milk feed this baby.
So how then do we support mothers to continue breastfeeding?
They need that social support from the health workers and caretakers. And then as the mother is preparing to start work, we encourage that they express out the breast milk and keep it in the freezer for future use, so that they continue breastfeeding even when they go back to work. But we encourage employers and work facilities to always organize a corner where nursing mothers can continue to express and keep their breast milk for their babies, because continued expressing of the breast milk enables continuous letting down of the milk so that the mother can have enough volume to sustain the baby up to 6 months.
Do we have a situation where a mother can actually fail to produce enough breast milk? And what are the alternatives therefore?
For you to have adequate production, you need to have a settled mindset, because the hormone that is responsible for milk production is released from the brain. You need to have enough intake, most especially fluid intake, and then you need to be relaxed, and frequent and regular latching on the breast stimulates the brain to produce the hormone, and that is translated as enough milk. So sometimes because of stress, or maybe a mother not having enough to take in, they don't have enough to drink, enough to eat, or the mother is unwell herself, or they tend not to have enough breast milk. But in such a situation, we ask the health workers to support them and the family so that the mother can latch more frequently. Sometimes we need to bring in counseling services to help this mother relax. And sometimes we give medicines to help the mother stimulate breast milk. But in case we cannot get a breast milk donor, or the family has not consented to it, we turn to the alternatives, that is the formula milk.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.